USMLE style question, atherosclerosis. A 55-year-old man presents to the clinic for a routine checkup. He has a history of hypertension, hyperlipidemia, and type 2 diabetes mellitus. He is a current smoker with a 30-pack-year history. His blood pressure is 140/45, and his BMI is 31 kg/mg. Laboratory tests show total cholesterol, 240 milligrams per DL, LDL, 165 milligram, HDL, 35 milligrams per triglycerides, 10 milligrams per A. Which of the following is the earliest event in the pathogenesis of this patient's most likely vascular condition? A. Deposition of fibrin and platelets at sites of endothelial injury. B. Migration of smooth muscle cells into the intima. C. Accumulation of oxidized LDL in the arterial wall. D. Endothelial cell dysfunction leading to increased permeability. E. Formation of a lipid core covered by a fibrous cap. D. Endothelial cell dysfunction leading to increased permeability. Explanation. Atherosclerosis is a chronic inflammatory disease of the arterial wall that leads to the formation of atherosclerotic plaques, increasing the risk of myocardial infarction and stroke. The process begins with endothelial dysfunction, which is triggered by risk factors such as hypertension, smoking, hyperlipidemia, and diabetes. Pathogenesis of atherosclerosis. 1. An endothelial dysfunction, earliest step, increased permeability to lipoproteins, LDL, and upregulation of adhesion molecules, VCAM1. 2. LDL oxidation. Oxidized LDL is pro-inflammatory and attracts monocytes. 3. Monocyte adhesion and transformation into macrophages engulf oxidized LDL, forming foam cells. 4. Fatty streak formation, earliest visible lesion, made of foam cells. 5. Smooth muscle cell migration and proliferation, stimulated by platelet-derived growth factor PDGF. 6. Extracellular matrix deposition, fibrous cap formation, leads to a stable plaque. 7. Plaque rupture, complication stage, exposure of thrombogenic contents can cause acute coronary syndrome. Why the other answers are incorrect. A. Deposition of fibrin and platelets at sites of endothelial injury occurs after plaque rupture, not in the initial stages. B. Migration of smooth muscle cells into the intima occurs later after foam cell formation. C. Accumulation of oxidized LDL in the arterial wall happens after endothelial dysfunction allows LDL to enter. E. Formation of a lipid core covered by a fibrous cap describes a mature plaque, not the earliest step. Key takeaways. Endothelial dysfunction is the first step in atherosclerosis. Risk factors include smoking, hypertension, hyperlipidemia, and diabetes. Oxidized LDL plays a key role in foam cell formation and inflammation. Plaque rupture can cause acute coronary syndrome, MI stroke.